My name is John Flett. I'm a pediatrician who helps parents, families, and schools and teachers with children that think and learn differently, and particularly ADHD. It would be great if we could treat ADHD with all the kind of natural alternative options. I believe as a pediatrician, you've got to look at things holistically. Every child is different. Let's start off by saying that management of a child with ADHD is not just a drug and medicine. It is a very small part of the solution. When I do an assessment, I talk very little about medication. It is an important ingredient, but it's everything else. So what I'd like to talk about, not necessarily all the different options that involve occupational speech therapy, dealing with the complications, comorbidities, sleep, and those kind of things. Those are very important, and I've discussed those in my other videos. But today I'm going to talk about alternative therapies. Therapies that kind of fall maybe into that not so conventional treatment. There are two groups of parents that I see who've often explored extensively. And they often tell me, been there, done it. When you Google alternative therapy for ADHD, just be very careful when you look at all those search terms and those search kind of findings at the top of the page with the ads. They're trying to compete for your attention. They're trying to get you to part with some money. So obviously the strategies for alternative therapies doesn't necessarily, for me, what I'm going to discuss in this video, training for parents, strategies to change your child's behavior is important, educational programs to help your child, and then of course medications. But let's talk about some of the alternative therapies. I think the difficulty with these alternative therapies is that they haven't been subjected to vigorous, strenuous scientific proof. And sometimes these things are very difficult, which I do appreciate. But when you've been practicing for a long time, you start to recognize that you can't just ignore those alternative therapies, because not every medication is going to help your child. Medication for ADHD is successful in probably about 85%. But how about that 15%? You might have a child that falls into that 15%, that doesn't necessarily react like chalk and cheese to a medication. So what else is available? Maybe your child has a lot of side effects on medication. And you can't treat a child for every waking moment of their life with a drug. So you've got to implore and intervene with alternative options. So one of the things that diet has been looked at, and I think it's a very important part. It's not something to ignore. So for me, diet is the most important sort of alternative to medication. Making sure it's high protein in the morning, eliminating the carbohydrates. Some children are sensitive to preservatives. It's not necessarily the cause of ADHD, but it is an aggravating factor. And I think that is so important to think about. Diets without, say, sugars or additives can be helpful in the symptoms. Vitamin supplementation. The only real vitamin that has been shown, it's a supplement really. It's more the omegas and omega-3s. So vitamins, if we talk about the fat-soluble vitamins and the insoluble vitamins, A, D, E, and K, be very careful, because high dose of vitamins can actually cause problems and harmful to the liver. During the lockdown and the middle of COVID, I saw a child who I've been treating for ADHD, and suddenly they'd kind of not really sort of been doing as well, They sort of kind of really fallen off the wagon, as it were, with the ADHD. They weren't doing as well. And when we investigated, that child actually had been given high-dose vitamins, not so much for the ADHD, but for the COVID. and their symptoms, they had flu-like symptoms, they were unwell, stomach ache, headache, upset tummies. And when we removed all those vitamins, everything came back to normal again. They were functioning well in class on their normal ADHD medication. So be very careful with vitamin supplementations. If your child has a huge eating difficulty, nutritional problem, speak to your doctor about vitamin supplementations because they can be dangerous. Then there's the additional fatty acids such as fish oils, primrose oil, and there are also some different kind of alcohol-related kind of combinations with fatty acids. It's called dianols and nootropics, so-called smart drugs that are in combination with these fatty acids. So those are some things that can be helpful. Then, of course, there are the herbs. Now, everybody wants to remain calm and everybody wants to look at those options. But, unfortunately, there's nothing that's going to make it dramatic to improve your memory and improve your cognitive thinking. Because herb products are not regulated, make sure that you ask a pharmacist about the purity, how strong it is, how safe is it? Is it toxic? Can it cause harm? There are products like valerian, which is used to help with sleeping problems and anxieties and headaches. Blue-green algae I've heard about, can cause stomach upsets. Ginkgo biloba is another one, which is meant to help with brain function. But all of these things in children have not been tested and can cause some side effects. Then there are the antioxidants, the so-called anti-aging remedies, which are meant to protect nerve cells. But there's no direct effect on ADHD. There's no evidence that this can improve issues with children. And I've seen children who've been taking these things and have been referred for to have their tonsils out or adenoids out and have had blood tests to check the clotting. And these have actually impacted the clotting and caused a child to be sensitive to a bleeding disorder. So be very careful. Melatonin can help with sleep problems, but it's got to be given in the right dose. It can't be such a high dose, so it can also trigger some side effects. And then, of course, homeopathy is used in combination with plants, mineral extracts, and so forth. Unfortunately, no studies have shown that these products are effective for ADHD. Then there's areas to think about that are not just supplements, but biofeedback. And it's meant to help people control their own responses, looking at how they control their brain waves through a computer program and electrodes on the brain. If you think there are a lot of people that promise lots of benefits, but, they want 40 sessions and over 1,000 Rand a go. If you think of the money parents have to spend on these kind of expensive alternative therapies, you could have tutors, you could have occupational therapy, remedial input, you could probably afford to send your child to a different school, all for the cost of what biofeedback would offer. And it doesn't show any lasting impact. So it's really in the early stages of experimental therapy. It may help some children, but I don't think it should be the first thing that you should do. If everything else doesn't really work or is not as effective, that might be a nice to have as an additional therapy. Then there's also hypnotherapy, which might be helpful for certain children, such as with sleeping difficulties and with tic disorders. Then there's vision therapy, ocular vestibular treatment, and sound training. That really, for me, is parents who really are having a lot of difficulty accepting the problem with ADHD. And these are very experimental. And in my opinion, in 22 years, I've never heard a parent tell me that those things have been exceptionally useful. So think scientifically. Get somebody who thinks about things holistically. I don't ignore any alternative therapy. I think one has to look, we have to be realistic, and there's some children who are going to benefit from these alternative therapies because a lot of medication, a lot of other interventions don't really work. Tell me what you think about alternative therapies.